The second one is Zika virus, which is the arbovirus as well. Okay, Zika virus belongs to family Flaviviridae and genus Flavivirus, which included such as yellow fever virus, tick-borne encephalitis, also dengue, hemorrhagic fever, West Nile fever, and it has an envelope as the dengue virus, and also the shape has a spherical and icosahedral symmetry. The size is about 50 to 60 nanometers. It has a capsid and membrane protein. This virus is single-stranded positive sense RNA, which divided into structural and non-structural genes. This structural belongs to such as here with the membrane protein, capsid, and envelope protein. And this one is a non-structural protein that's encoded by these genes, and it plays a role in the replication of the virus, such as the enzymes like RNA-dependent RNA polymerase that we call RDRP. That's important for the single-stranded RNA in a plus strand. For transmission, they have syllabic cycle and urban cycle. This syllabic cycle means like in the wild, which you see the monkeys here, and so you can recognize that this vector is the mosquitoes, and these also reservoir of it like the monkey. And for these, it can, in the syllabic cycle, it can also has a vertical transmission in the mosquitoes as well. That means these mosquitoes lay the eggs, so the mosquito has the infection with the Zika virus. Then the baby or the larva of these mosquitoes in the eggs also has the Zika virus as well. And in the urban cycles, it means that you have the mosquito that bites person to person, like this cycle. And also in venereal transmission, the Zika virus can transmit from pregnant mother to the children. Okay, but for 70 to 80%, the children are uninfected, so which has left about 20 to 30% that get infected, and that neonates or that babies has infected with this virus got some disease, such as may suffer with the CNS or central nervous system disorders, and 4 to 6% of the child born got the microcephaly, which means that the brain is quite abnormal and it's smaller than normal. And 4 to 7% has a fetalosis. Zika virus has a replication cycles as other virus like dengue virus. So the first one, they got a receptor binding and endocytosis to the host cell, and then got the endosome, and the proton will destroy the envelope and the RNA of the single-stranded RNA from virus release. And this replication cycle happens in the cytoplasm. And then it's immature and virus assembly in the ER or endoplasmic reticulum and go outside the cells after it's mature. It's released outside the cell. Okay, for the clinical manifestation, this Zika virus affects so many organs such as placenta, brain, eye, body fluids, uterus, and vagina, and also testes. The generally infection causing the symptoms like short-term and low-grade fever, micropapular and pruritic rashes, got a rash in the skin, non-purulent conjunctivitis, this is an eyes infection, right? Arthropod, fatigue, nausea and vomiting, edema, loss of appetite, abdominal pain, diarrhea, sore throat, cough, and redness of the eyes. Such very similar to the dengue fever. For the acute infection, there has a headache, myalgia, hematospermia, asthma, asthenia, hearing loss, retroorbital pain, and subcutaneous bleeding. Also, there are many symptoms like acute myelitis, microcephaly, as I said before, that happens to the baby born, right? And also it's kind of has cardiac complication as well, like myocarditis and pericarditis. And also that special one is the Guillain-Barré syndrome. This syndrome causes the abnormal at the muscle, because this Zika virus can affect to the central nervous system. So these muscle got the central nervous system as well, no? So it's related to it. Okay, and for the epidemiology of this Zika virus, it can be found in the countries such as South America, and also you can see it in the Southeast Asia, like Thailand as well, and also at Africa, where in the world it has a lot of forest. Okay, so the Zika virus laboratory diagnosis, the gold standard of the acute phase still BRT, PCR, or in AAT, no? That the specimen can be serum, plasma, urine, or any other fluids like saliva, semen, amniotic fluids, no? For the key point indication, it's detected like first 3 to 7 days during early infection. For the urine, it's detectable longer than blood, so up to 14 days. And other fluids as selected cases, แล้วแต่แสดงอาการนะคะ For the IgM, you can detect for the ELISA or MAC ELISA use after acute phase about more than 5 to 7 days. IgG for the past infection, plaque reduction neutralization test used for confirm Zika infection and differentiates from dengue. Virus isolation cell culture using the specimen like blood or urine to perform, and prenatal testing from amniotic fluid or fetal tissue. Okay, for the treatment and prevention, the treatment there's non-specific. There's no antivirus drug for the drug of choice, just supportive care only. So if you dehydrate, just balance the hydration and rest. And the Zika virus also has a myalgia, right? กล้ามเนื้ออ่อนแรงอ่อนเพลียปวดกล้ามเนื้อ so you can use the paracetamol, acetaminophen for antipyretics, analgesics. Avoid NSAID like aspirin because it's a risk of bleeding. For management of complication like Guillain-Barré syndrome that cause like the neurologic complications, so you can just only talk to specialists and support them, support the patients. For the congenital Zika syndrome, it has to be the multidisciplinary management. So every staffs like doctor, nurse, everyone has to like brainstorming and discussing for to treat the patient that has congenital Zika syndrome. For the prevention, eliminate the mosquito breeding sites, use insect repellent, wear long sleeves, use window screens and bed nets. In the area that has a lot of mosquito or has a risk that the mosquito will bite. For the prevention, for the sexual transmission as well, using condoms and abstain from sex after exposure or virus, and that virus can persist in for months. As you know that the Zika virus can be found in urine and fluids, so that's it. For the prevention, pregnancy should avoid travel to the endemic areas or prevent mosquitoes bites during the pregnancy. And also we don't have any virus available for the Zika virus. Okay, for the last arbovirus named chikungunya virus. This one firstly found in Africa in Mozambique. So the name of this is quite weird, strange, sounds not so familiar for us Asian. Okay, for the structure, family names is Tocaviridae, genus Alpha virus. It has envelope as well. In the envelope, there are the glycoprotein, which is E1 and E2. The important role of E1 is it is a membrane fusion protein, and for E2, it is the receptor binding protein. So E1 and E2 is in the surface of the envelope and form the heterodimers like in this picture. It's assembled into the spikes, and the surface of the virus. And also this chikungunya virus has a capsid protein inside. The shape is spherical and icosahedral symmetry. The size is around 60 to 70 nanometers, and the genome of it is single-stranded positive sense RNA again. But this one is non-segmented virus genome and come with the linear. So it has just only one segment, and also it's function directly as mRNA because it's single-stranded positive sense RNA. Okay, in the genome, it's divided by the role that can encode the non-structural protein and also structural proteins. No, for the transmission of chikungunya virus, there are three main cycles, which are urban epizootic cycle and rural epizootic cycle. The main vector are ED aegypti and ED albopictus, depends on what is the epidemic area. So the first one, urban cycle, the mosquito binds directly to the human. So this is a human amplification, human to human. And for the enzootic cycle, there are evidence that some animals, including like non-primates, like rodents such as mouse, birds, and small mammals like monkey can also the reservoirs of the virus. So this mosquito bites this reservoir virus to get the virus inside them, and then these mosquito as play as the intermediate vector can bite the people like humans. And also with the rural episodic cycle happens the same as the enzootic, but this one the host or the reservoir will be like the horse that's live next to or closer to the human, and this mosquito bite the reservoir and got infected by that reservoir and bites a human. So this is a domestic animal that can amplify the virus, and human got infected to these because of the vector, like the mosquito. Okay, this is a cycle of the virus inside the mosquito and before it infected to the human. So in the mosquito, this mosquito bites into the infectious host, and then this mosquito got infected. The virus can amplify themselves in the midgut or กระเพาะอาหาร of the mosquito and then circulate it in the system, disseminate into the salivary glands or ต่อมน้ำลายนะคะ ready to spread to the host like humans. After the mosquito bites the humans, the salivary glands that has the virus transmit to human via the wound or the bite, and then the human got the virus that enter to the fibroblast and replicate on it at the fibroblast cell, and then disseminate to other tissue, other target tissue like liver, joints, lymphoid, lymph node, muscles, and the brains, and got the pathogenesis in that kind of organs. For the replication cycle is quite the same as other arbovirus. So it's binding with the fusion protein E1 and then enter the cells by endocytosis, and then they have single-stranded RNA, which is a positive strand, and then replicate and translation and replication at the cytoplasm เนาะ and the virus assemble again and budding to release into other cell other for pathogenesis as we mentioned about it after the ED or mosquito bites into the skin the virus enter the cell and replicate at the fibroblast cell inside the dermis of the dermis and then disseminate to the circulation and go to the target organs such as joints, muscles, skin, and liver, spleen, meninges in the neonates, like that. And then what comes to kill the virus are the inflammatory cells, right? Like white blood cells. And this has a pro-inflammatory cytokines and the cytokine as well. So that cytokine occur the inflammation such as in the target organ like joint. So it got the effect of the inflammatory cytokines from the inflammatory cells, white blood cells, and got inflammation. So here in this graph shows you the incubation phase, acute disease solution, and chronic phase. For the incubation time or incubation period, about 1 week before symptom onset. So the viremia start rising, and after the acute phase, after the primary immune cells, T cell, NK cell come to kill the virus, this viremia or virus inside the blood vessel decrease, and it start to have IgG and IgM. And for 40 to 80% of the patient progress to the chronic phase of the disease. That means these kind of viruses quite survive in the body of the host cell. So when you have the IgM and IgG and also the pro-inflammatory cytokine, this could be happen like joint swelling, joint stiffness, arthralgia, and tendonitis or tenosynovitis. This is the main character or main symptoms of the chikungunya virus. Please remember this. To make it easier, you can see in this table, this is a characteristic that differences between chikungunya, dengue, and Zika virus. That is the arbovirus. So for the chikungunya, you can see that in the key role of the chikungunya symptom is arthralgia, which is joint inflammation. Dengue has a shock and hemorrhage. Meanwhile, the Zika virus has no shock and hemorrhage, but will dominantly seen at skin rash. Okay, for the epidemiology, as the name of chikungunya, definitely you can find it in Africa. Detect in Africa, North America and South America, and also in Asia. Okay, for the laboratory diagnosis, the gold standard for all the early phase still RT-PCR or reverse transcription PCR. For the specimen, can be serum, plasma, whole blood, Acute phase start from day 1 to day 7 and detect for the viral RNA, which has a highly sensitivity and specificity. For the virus isolation, like I said before, it's kind of like not so many hospital. It's very hard to do it, so we barely see it in a hospital laboratory. So it requires in a specialized laboratory, not routine. You can taste like ELISA for IgM and IgG to indicate a recent infection or past infection in the case of IgG using serum as a specimen. For the rapid serological test, you can use a screen tool like a strip test and neutralization test to confirm that this is the chikungunya, not other arboviruses. For treatment and prevention, so similar to other arboviruses, there is no drug, like specific drug for treatment, just rest, balancing the fluid inside the patients, keep balancing of the hydration, take the paracetamol and acetaminophen for antipyretics ถ้าเกิดการปวดข้อขึ้นก็ให้ยาแก้ปวดไปเนาะ Pain and joint inflammation control using NSAID and you have to know that the patient got infected by chikungunya virus, definitely not the dengue. If the dengue virus, you cannot use NSAID to give to the patients because it kind of has a risk of bleeding. For management of chronic arthritis, use the NSAID, low dose of corticosteroid in some case, and anti-rheumatic drugs in severe chronic disease. Avoid aspirin during the acute phase. Hospital care use IV fluids, monitoring vital signs. As you know that this chikungunya can go to many organs. Antiviral therapy, there is not such a thing available. For prevention ก็คือ mosquito control and personal protection. So here again, to summarize everything in one slide, and please remember these, like chikungunya, got arthritis, bleeding in dengue virus, microencephaly in Zika virus. So that's all for the arbovirus. Now let's talk about other types of virus. The first one is Ebola virus. So you can see this different structure that different from the arbovirus that we seen previous time. So here, Ebola is very dangerous virus. It's from family Filoviridae, genus Ebola virus. They have an envelope and the shape is a filamentous or thread-like, means เส้นได้ It can be pleomorphic, so it means that it can change the structure. Size are about 80 nanometers, and length varies, can be 800 to 2000 nanometers or longer. For the genome, it is a single-stranded negative sense RNA, come with a linear non-segmented, approximately 19 kilobase, and has 7 proteins of Ebola. So here is the genomic RNA. That this one, as you know, that genome is single-stranded negative sense RNA, so it has RNA-dependent RNA polymerase with this virus. And also these, you can see the structural viral proteins such as VP24, VP30, VP35, and VP40 that we'll talk about next in this slide. Okay, so what is the role of it? VP24 is for the virus assemble. So it's a part of nucleocapsid structure. And VP30 is inside here. So it used to suppress the viral RNA splicing. So other one is VP35. VP35 is here. So it binds to nucleoprotein to remove the nucleocapsid for the transcriptional expression. And VP40 required for the virus localization out of the host cell. So it helps the virus to go out of the host cell membrane and maintain the filamentous shape. Okay, and the L1 is RNA dependent RNA polymerase. This one is quite very important for this virus, as it is the enzyme that relate and help this virus for the transcription and genome replication. Okay, so for Ebola virus, they has a lot of species, but mainly these 6 species that's important. The main cause pathogenic to human is these 4 species, which is Zaire, Sudan, Bundibugyo, and Thai forest. This is highly pathogenic to human. For the resident, these also lethal to human as well, but it's highly pathogenic to non-human primates, such as monkey and guinea pigs. And for this Bombali, this one is the one that not infected in human, as long as there is no record for human infection yet. And come to the transmission. This Ebola virus can replicate and stays in the fluid, body fluid. So it's not airborne spread like the our virus, but this one is direct contact, transmit through direct contact. So you have like zoonotic, like animal to human transmission, human to human transmission, also sexual transmission, and nosocomial transmission. Nosocomial means the healthcare associated, like in the hospital infection. Okay, so zoonotic, it happens when these animals like fruit bat, African fruit bat, this one, you know that it's fruit bat, so it eats fruits, right? Like banana. So this one, this bat bites the banana, eats the banana, so it has like some kind of saliva or fluids stuck in the banana, and the intermediate host like non-human primate like monkey, chimpanzee, gorilla eats it. So this one is the intermediate host, no? And then human eat these bush meats, means that like กินสัตว์ป่า eat the wildlife like African footpads or even monkey, chimpanzee or gorillas. This happens in the Africa, so you know the people eats that kinds of animals. And after eating that, its incubation time about 2 to 21 days, and the symptoms are fever, arthralgia, sore throat, and fatigue. And for the fatal phase, it's 7 to 14 days, and this is severe phase, more severe. Happens like the symptom like hemorrhage, organ failure, septic shock, and leads to death. For the human to human transmission, it's by direct contact with like body fluid, blood. Also like vomit, diarrhea, urine, saliva, sweat. So all of the body fluids can be infected. Broken skin, mucous membranes, if you have like some kind of a skin rash, skin breakage, like wound, or some kind of like skin, soft tissue like eyes, nose, mouth, contaminated with some objects like needles, syringe, bedding, medical equipment, something like that. And if that patient is lucky, so they recover from the Ebola, it can be, that patient can be full recovery, or the virus still persistent in the body and not get rid of all of the virus, so that patient can be chronic symptom with all virus persistence, and can be reinfected. So this cycle, they can contact to other transmission to other people, so they infect other people and new Ebola outbreak happens. For the sexual transmission, as you know that these virus can contact directly with the blood and body fluids. So in semen also can find this sexual transmission with this sexual transmission. And for nosocomial infection, it happens by poor control practices in the hospital. For the replication cycle, it's because this virus is quite long and big, so they use macropinocytosis to enter the cell, host cell, and then they get the fusion at the endosomal membrane and release the negative stranded RNA and transcribe in the cytoplasm and go out of the cell, because this one has an envelope, so it's budding. Okay, so for the Ebola virus pathogenesis, so patient got direct contact with the fluids, or maybe eat the flesh, meat with these wild animals like gorilla or any fruit bats. So these viruses enter the cells or the host cells and go through the, for example, in the lymph node, nearby lymph node, that is the reservoir of the macrophages and dendritic cells. So infected macrophages will release chemokine to recruit another naive macrophage, means new macrophage that is not infected to become infected, and also can release the cytokine such as interleukin 8, TNF alpha, nitric oxide. This one will it is a pro-inflammatory cytokine that that affect to the blood vessel นะคะ leading to um, the fluid leakage เนาะ and also for the liver these virus can make the liver infection and necrosis so it decrease the production of the clotting factors so when it got the hemorrhage this clotting factor is decreasing and lack of this clotting factor leading to hemorrhage for the adrenal gland นะคะ the synthesis of the steroids will be decreased because the abnormality or impair of the cortisol cells for the clinical manifestation because this Ebola virus can infected and go through a lot of organs such as in the eyes like soft tissues so you can see like conjunctival injection uveitis like this and also dehydrate with the nausea and vomiting for the hepatic dysfunction pulmonary to the lung like the psychological support like if you have the depression or anxiety go to the brain to get an encephalitis or analgesic some pain like headache arthralgia myositis and also like go to the renal like kidney the diarrhea endothelial dysfunction like vascular permeable fluid leakage and also it can get a co-infection with the bacteria and some kind of a malaria as well so here is the treatment okay for the incubation period for time 2 to 21 days there's no symptoms but the period of illness we divide it into early symptoms mid symptoms and severe symptoms for early symptoms the time is around 3 days so you have like fever fatigue headache sore throat it's normal for the fever or for the flu right so in the 3 to 10 days it developed to mid symptoms like you got the diarrhea vomiting stomach pain and hiccups คือสะอึกเนาะ so this is a moderate to high and for the severe symptoms 7 to 12 days these kind of symptoms get the fluid leakage leads to the fluid leakage like severe diarrhea vomiting and bleeding so as you know that Ebola virus from the species the name of the species is quite strange and not familiar to us so it happens in Africa okay for the laboratory diagnosis RT-PCR still the gold standard and within the few days you can use ELISA IgM PCR virus isolation for the later disease or after recover you can detect IgM and IgG antibody after the disease retrospectively in disease patients we use the immunohistochemistry testing PCR or virus isolation and here for the specimen acute illness we use whole blood or plasma convalescent phase can use blood or semen and post-mortem means after death so the corpse we can use oral swab or tissue for the treatment it's still supportive care still be the main treatment So if you dehydrate, just balance the rehydration, like that. So we use the intravenous fluid, and electrolyte replacement, maintain the blood pressure, oxygen, and oxygen concentration, hypoglycemia, treat with the hypoglycemia, fever or pain, use the analgesic drug, blood product for severe bleeding, so give the blood. So this is the most important treatment to reduce the mortality, to reduce the death rate. And also we can use monoclonal antibody therapy like Imacept and Ivanka. These two is the monoclonal antibody that quite effective to SARS, Ebola virus. And you have to give them in early detection infection. For the convalescent plasma, this is for a patient that recovered. So you give the plasma to the patient by the patient that's already recovered. This is not the first line drug, so it has to be considered from the staff. For the co-infection, you can treat the antibiotics for the bacteria, and anti-malaria for the malaria infection. But this is not effect with anything with against Ebola virus. Just only bacteria and malaria. Infection control measure, like if you know that patient infected with the Ebola virus, so you have to isolate that patient, and for yourself using the PPE, and control and strictly control in a hospital to prevent the transmission to other people or other patients. For the vaccination is for prevention only. So we have Vibo or RVSV CBOV. Used in the case of outbreak. And for the prevention, as we mentioned before, that this Ebola virus can spread by direct contact, so you have to avoid physical contact. Wash your hand with soap and clean water, so this is an aseptic technique. Just do it frequently, as frequent as you can. Do not shake hands. Keep away from bats, monkeys, baboons, and dead animals. Don't eat flesh or bush meat, and cook it all very well. Make it well done. For Marburg virus, the structure and genome, you can see the shape here. It's filamentous or thread-like. It can be pleomorphic as well, like the previous one. The family is Filoviridae, genus Marburg virus. It has envelope, so you can see it here in the purple line. There are nucleocapsid, which is the helical structure inside the envelope, and the genome is a negative sense single-stranded RNA, non-segmented. And here is the genome. Okay, so this is consists of the viral proteins, which is genome encoded. So it's quite similar to the previous one or the Ebola. So it has new NP or nucleoprotein, VP35, VP40, glycoprotein, VP30 and VP24, and especially L protein, which is the enzyme RNA dependent RNA polymerase. for the virus transmission, they originate by these Rosetas aegypticus, the fruit bats, as before as Ebola virus, and spread by the direct contact transmission, maybe by biting or by body fluids, such as in the case of these fruit bats eat the fruits and that contaminated fruits are eaten by human, or even this human eat directly the rosetas, the fruit bats, and in another way around, it can direct contact with the non-human primates, like human can touch or even be bitten by these non-human primates like monkey, and also this human can transmit this virus to other humans as well, by direct contact with the fluids, body fluids. Semen also for the sexual transmission, and also non-human primates like monkey can also spread this virus to other non-human primates as well. The pathogenesis is still the same as the Ebola virus, so it happens when the entry of the virus, and it infects with the dendritic cells or the macrophages that's in the lymph node, and it goes for the NK cell or with the frail or fast pathway. This one you don't have to remember it. Just know that these NK cells and the macrophages release these cytokines, and it affects to endothelial cells, NK cells that got the apoptosis lymphopenia, go to leading to the immunosuppression for the NK cell, and these inflammatory cytokine storm increase the vascular permeability in the blood vessel, and also if the plasma leakage, hemorrhage, right, it can lead to coagulation dysregulation, or we can call it DIC. For the hepatocytes, these virus go to the hepatocytes in the liver cell, causing the liver dysfunction, so it produces less clotting factor. And for the adrenocortical cells, this one relates to the hypotension, metabolic disorders, so it leads to shock in the multiple organ failures. For pathophysiology, this Marburg virus is dangerous, as dangerous as the Ebola virus, but it spread less than Ebola. So you, I think you might know about Ebola virus and heard about it more than the Marburg virus, but it's kind of like very dangerous as well. When you have to deal with these virus, you have to do or investigate in the high level biosafety laboratory. So this, after Marburg virus infected to the host cell, for the prodromal symptoms, incubation time about 2 to 7 days. So you see the high fever, severe headache, malaise, muscle pain, like that in the prodromal symptoms. And after that, for 5 to 21 days, it is the onset of clinical features, that you will see the clinical features like fresh blood, vomiting in vomitus in vomit and feces. It means that you see the blood stain in the vomit and feces, bleeding nose, gums, vagina, venipuncture CNS, which is a central nervous system. Go to the central nervous system to got the confusion, irritability, and aggressive. Arthritis, severe water diarrhea, abdominal pain, cramping, nausea, vomiting, severe hypertension, multi-organ failure, that it leads to death. No? So in severe case, about 8 to 9 days, just only 8 to 9 days, and then people collapse and dead. For the epidemiology, you can see that in the mid-Africa country here, in the middle part of the Africa region, you can see the outbreak in here. No? In Russia also the case has a case in 1990s around that, but it happens of the outbreak because of the mistake of the laboratory. It's not the originate outbreak, but it's from when you want to taste the virus and then it's leakage or spread out. For the USA, this one we don't know but they record as the outbreak strain by the different country, means that maybe the African people goes to the USA, no? And it happens in 2008, and they say that it's Uganda origin. For the laboratory diagnosis, still the RT-PCR is the gold standard, no? And other can be investigate like the antigen detection, IgM, IgG for ELISA, virus isolate, electron microscope, no? For the post-mortem or the corpse, no? You can use tissue for a specimen to investigate it in immunohistochemistry. And also you can use the oral swab. For the treatment and prevention, the mainstream still supportive care, be the supportive care like the Ebola virus. So it helps a lot for reducing the mortality rate. And for the experimental antiviral, so because of the Marburg is less spread than Ebola virus, so they still not have doesn't have the specific antiviral, like remdesivir and favipiravir is still in the investigational process. For the monoclonal antibody, still in the research stage as well. Convalescent plasma from the recovered patients, they has limited evidence and it's not standard treatment. This Marburg virus can infect with the co-infection with the bacteria as well. So we treat with the antibiotics, and if it's co-infection with the malaria, we can use the anti-malaria drug. And for the control and isolation, still the same as the Ebola virus. So we use the PPE, safe handling specimen and bodies, and isolate the patient. For the vaccination, still underdeveloped. Then this is for the prevention. Hand hygiene, sanitize, avoid direct contact. Don't eat bush animals, protect themselves, not shake hand or avoid the direct contact. Okay, so last one is hantavirus. Hantavirus. Go back to the spherical virus, but this virus is the rodent borne, especially mouse. So hantavirus is in family of Hantaviridae, genus Hantavirus. It has envelope. Shape is a spherical, and it has a capsid as a helical nucleocapsid, surrounded by the surrounded genome. So the genome is negative sense single-stranded RNA with 3 segmented has 3 segmented is S, M and L small, medium and large เลยนะ The surface protein has GN and GC which maybe called G1 and G2. This one is the glycoprotein that encode in the envelope at its form spikes like the viral surface. Any other virus used for attachment and enter into the host cell. Okay, so genome segment for small segment it's encoded nucleocapsid protein. For medium segment encode the envelope glycoprotein. Large definitely with the RNA dependent RNA polymerase or L protein. Okay, for transmission it begins with the rodent such as mouse. So you can assume that this hantavirus spread out or outbreak in the city which has a lot of rodent like mouse and so hantavirus can spread by inward breath of the aerosol for the viral particle that is in the urine, feces or saliva discharge in the environment. It can infect with the livestock and a farmer and inhale in the viral particle by human. Okay, so it's acute it is an acute respiratory infection. So the replication as a spherical virus. So it's enter the cells, host cells, and then unhost, replicate in the cytoplasm, and go out with the envelope. So it's used budding. For the pathogenesis, these hantavirus cause pathogenesis in the endothelial cell mainly. So it happens with the vascular leakage and platelet activation. So hantavirus infect endothelial cell to increase the vascular permeability by disturb the endothelial cell to cell contacts in the protein named cadherin. This is a connective protein that connect or adhere to the junction of the vascular endothelial cell by the VEGF-A and bradykinin. And it also can activate the platelets by using the viral glycoprotein to attach or direct contact to the platelet integrin alpha 2 beta 3 or endothelial cell, causing damage and release the fibrinogen, fibronectin and von Willebrand factor. So these after activate the platelets, the coagulation factor will be decreased, right? So it causes thrombocytopenia because platelet has been used. Okay, for the clinical manifestation, it has two kinds of syndrome, which is HFRS or hemorrhagic fever with renal syndrome and hantavirus pulmonary syndrome or HPS. So the first one, HFRS, is quite not severe. So it's most of the patient can recover by themselves by supportive care. This happen at kidneys as the renal syndrome, as it's mentioned in HFRS. And for HPS is pulmonary, so you can assume that the main organs that affect is lung or cardiopulmonary system. The geographic areas that dominance is Europe and Asia for HFRS, and for pulmonary is in America. So this one, pulmonary syndrome, is quite severe and has a high mortality rate, without intensive care. So what happened is these causative species like Hantan, So, Pumala, and Dobrawa, this is the name of the species causing the HFRS. Meanwhile, Cinnabar and Endes is cause the HPS, and the initial symptom is the same, like normal symptom for the flu, headache, malaise, myalgia, and fever. For the hemorrhagic, because these hantavirus has the target cell in the endothelial cell, so it causes the petechia and bleeding. For renal, it happens to has the acute kidney injury, oliguria, and proteinuria. Oliguria is ปัสสาวะน้อยนะคะ and the pulmonary involvement is mild and absent, can affect with the hypotension, and in severe case can be shock, can lead to shock in the patient. The progression of the disease come from the febrile, hypotensive, oliguria, diuretic, and convalescent phase. As you know that this is most recovered by patient and with the supportive care. So the case of fatality rate is not so high. So it's 1 to 15%, depend on the species. And for HPS, the pulmonary involvement is severe pulmonary edema ก็คือน้ำท่วมปอด and also in the cardiovascular effect is a hypotension and cardiogenic shock, rapid progress with the respiratory failure leads to fatality rate that kind of high, like 30 to 40%. For the epidemiology, we have oval hantavirus. It means that the city that developed, the old city that developed, like European country, count as the oval hantavirus or hemorrhagic fever with renal syndrome, affect with this kind of renal syndrome, which is not so severe. But for the newer hantavirus, or it happens in America, North and South America, this is a hantavirus cardiopulmonary syndrome, which is more severe and leads to high risk of the death rate. And also nephropathia edemathica is here in the is HFRS, HFRS, which is in Russia, like species like Hantan and Amur. Okay, for the laboratory diagnosis, no, this one, they pay attention to the IgM and IgG antibody. So you can investigate the IgM and IgG via ELISA or IFA. This is commonly used in the laboratory diagnosis. So IgM, you can indicate acute or recent infection. IgG for past or late infection. So this is the main diagnostic method. We can also use RT-PCR, immunohistochemistry, to use the tissue like lung or kidney for a specimen, for detect the viral antigen, and mainly for the post-mortem diagnosis. So it means that for the corpse or the dead body. So for the virus isolation, we rarely perform, and the rapid test we use, like the rapid test is like kind of use of serum as a specimen. So this is a screening tool only. For treatment, it's also the supportive care, no? For this, you can read by yourself. It's the same, no? So you use the oxygen therapy if you have a plasma leakage. A lot of the plasma leakage, you can treat with the fluid management, support with the electrolytes or fluids if that patient's lack of it, no? For the hemorrhagic fever with renal syndrome, I can use the dialysis for the acute renal failure ก็คือฟอกไตนะ and for hantavirus pulmonary syndrome or HPS, you support the patient with the ventilatory support เครื่องช่วยหายใจเนาะ and admit to the ICU earlier, and ECMO can use ECMO อันนี้เป็นเครื่องช่วยหายใจแล้วก็ช่วยเรื่องหัวใจด้วยนะคะ so this kind of treatment can support the patient to reduce the risk of death. Antiviral therapy, they have some case or some report that ribavirin may be beneficial to the HFRS but not in HPS. For treatment for complication, so you have to be aware of the shock. So it comes with the organ failure. So you have to manage with the shock management and treatment of the secondary infection, like maybe co-infection with the bacteria. So you can treat the patient with the antibiotics. For the control and prevention, definitely rodent control. So get rid of rodent or mouse. There is no person-to-person transmission except the enterovirus and this virus. Avoid exposure of the rodent excreta like urine or feces. Use the PPE for clean up, and there is no vaccine available. So this is a prevention. Get rid of the mouse by seal up. Keeps wild mice away from your home. Trap the rodent and clean up the rodent waste like urine or any contaminant. Okay, so it's the end of this class. Hope you good luck.